elbow, social distancing. We are live on Instagram, Facebook, and Twitter. Myself and Councilman Kristerfer Burnett, chair of the Health Committee for the Baltimore City Council and the designated expert to all things COVID for the Baltimore City Council. So we're doing this live feed.
A lot of pressure.
Live feed together tonight. We work well as a team, basketball, but also health crisis. So we're gonna do a update together. I'm gonna start by just giving some general updates about some things that came down today. Kick it over to the councilman for some updates from COVID, as he's been in the information center, right in the thick of it, in the room with the latest stuff that's going on. So we know today some more mandates came down from Governor Hogan. We know now that the primary election has been moved to June the 2nd. However, if you live in the 7th Congressional District, that means if you voted for Elijah Cummings consistently and in the last election, you live in the 7th Congressional District. Remember, after the unfortunate passing of our leader, Congressman Cummings, we had to have a special election in February. The general election for that special election is still happening on April 28th and will be mailed in only. So please, please, please feel free to contact our offices about that, but also the Board of Elections, because we want everyone to participate in that election, period. No matter who you're voting for, it is your right to be able to vote in that election. Also, want to recap some other stuff. Governor Hogan also announced that all tolls in Maryland will now be cashless. Drivers can drive you through toll booths and will be sent a bill if you don't have an easy pass, but they're moving to cashless tolls, so that will also be happening. And recap the other mandates from yesterday, just in case people did not hear them. All bars, restaurants, movie theaters, and gyms across the state of Maryland, including Baltimore City, are closed. You can still order, carry out, and delivery from your favorite local eatery. And actually, we do so. Encourage that. I went to Terra Cafe to lunch today, a great place with great food. They got the best fish sub in the city, in my opinion. Continue to do that. Gatherings larger than 50 people are also still prohibited. Utility companies will not be shutting off services, so your internet, your phone, water, there will be no late fees, also will not be attached. And lastly, no one will be evicted during this state of emergency. So those are just some general updates. Start to send your questions in that you have for us. I'm going to kick it over to Councilman Burnett to walk us through some COVID stuff.
All right. So thank you, Mr. President. So the latest, there are 60 confirmed cases across the entire state of Maryland. 2 of those are in Baltimore City. And obviously we know, based on the nature of this type of virus, that we want, even though that number in Baltimore City is low, we do expect that to increase. So we are asking everybody to take all of the same precautions. Keep your consider this week like social distancing week, right?
Right.
This is the message that the health department is trying to push out, is that we want to make sure that people are staying apart, that they are washing their hands frequently, using hand sanitizer. If you can not meet, don't, especially to my community associations. I had a community association call with a number of my constituents on Monday about that, and I was like, look, if you don't have to meet. Mine's
supposed to be tonight. Miss Jackson, if you're watching, cancel the Frankfurt meeting. No meeting tonight.
Don't meet. Have a phone call, send an email, send a letter. Do not meet in person if you can avoid it, and that's mainly so that we can stop the spread of this disease. And from there, we're also asking that for all updates, make sure that you're following the council president's page, the Baltimore City Health Department's page, and the mayor's page, because the latest information is being posted on those feeds every single day, sometimes multiple times a day. That's where we want to make sure we're getting all of the information out to people in a timely manner. Also, go on the Baltimore City Health Department's website. There's a lot of information there. We want to make sure that you're getting all your information from trusted sources. So the only 3 sources that we're asking people to get information from are the Baltimore City Health Department, the Maryland State Department of Health, the CDC, and the World Health Organization. Go there first, because a lot of misinformation has been posted online, like we've seen in the past on social media. Don't believe it unless you have confirmed it, right? So if you see something that doesn't seem right, make sure it's confirmed. Reach out to your council office, reach out to the president's office, reach out to the mayor's office if you have any questions. And I know we have some questions coming in. Do you want to jump right into them?
Yeah, we just jump into them. So we see one about a couple things. I guess I'll tackle this one first, Chris. Around how many tests are in Maryland. I don't know if many of you saw the governor's press conference today. Listen, they are trying to expand testing. They are working. I saw the impatience in the governor's voice today with the CDC and the federal government around that. But again, we don't want everybody rushing to get tested. Like we've been saying consistently, if you have the symptoms, we want you, and they're not severe symptoms, right? Coughing, all of the fever, pneumonia. We want you to first call your healthcare provider to figure out what their advice is on how to. We don't want everyone to rush into the emergency room or to these centers, and we want you to heed that advice. If you don't have that, of course, we want you to continue to call 211, and they have a list of places where you can go. Everyone will not have the severe symptoms from this illness. We only want people going to the places in emergency room in emergency situations. So, Councilman, you want to take the next one?
So there was one on financial assistance for small businesses. What we're asking small business owners to do is go on whatever search engine you use, if that's Google, and type in Baltimore Development Corporation. They have a survey that's circulating right now, just started today. And actually, if you follow me on Twitter, I just retweeted it out. It'll be up on my page a little bit later on Facebook and Instagram.
Yep.
But there's a survey that we're asking businesses to fill out so that we can get a better idea of what the impact is on small businesses in Baltimore City, or businesses period in Baltimore City, and work on a response. As of right now, there are not any programs for this specifically, but things are moving really fast. So by the end of the week, we may have a different answer for you, but we're asking all business owners in Baltimore to fill out that form.
Yeah, and also, listen, we're going to put that information on our social media as well, so this is over, and continue to spread that information so everyone has it. So someone asked a question about are the admissions facilities going to be used for testing, and will they be open to the public? So the governor just laid that out today, that they're gonna be pushing to have that for drive-up testing. They did not have all the details for that. Those things will be coming. This is an evolving situation. It's going to continue to evolve over time, so stay tuned. As soon as we have the information about how those things are going to work, we're going to share that. Once the governor shares that with the public, we're going to make sure that we share that information as well.
So we have a question about payment for public schools employees. What I would recommend is reaching out to front office, North Avenue. I don't have an answer on how they're handling the HR functions, but what I will say is that all of this is moving quickly. So Baltimore City Schools has a lot of advisories that are being posted on their main website, but I would recommend reaching out to them directly. That's not an answer that we have at the moment, but I will say that the council will be advocating for a full recovery for low-income families, middle-income families, everybody that's impacted. We're going to be trying to make sure that folks get paid and are made whole. A lot of that is going to happen on the local level. A lot of it's going to be meaning that we need help from the federal government as well.
Absolutely. And all of that will happen, and we can rest assured that we're going to work with our partners at every level to make sure that stuff happens. There's a question about two that I'll handle really quickly. Are you mandating that the homeless be tested, or homeless shelters going to be impacted anyway? Well, there's no mandate for anyone to be tested, of course, unless they are showing the symptoms and there's severe symptoms. Are homeless shelters going to be impacted anyway? Yes, we know they're going to be impacted. They've already issued a shelter-in-place thing for our homeless shelters, so they're not pushing people back out onto the street. So that is also taking place in Maryland and in Baltimore City. And then someone said protections in place for service employees from hotels, airports, and train stations. So this is something today the governor did announce, like some things that they're going to be doing at BWI as far as how many people, where they're coming in, and we'll be sure to share that information out with you guys once we can take it from their website and put it out on our social media as well.
And then there's just a general question about available testing and how people in Baltimore can be tested. All right, so here's what we're telling folks. right now there are no just standard testing that you can just pull up to and get it if you aren't showing symptoms. If you are showing the symptoms, which again, all that information is on health.baltimorecity.gov, look at the symptoms. If you exhibit these symptoms, we are at first asking that you contact your primary care doctor, right? Call them first, explain what's going on, work it out that way. Do not go straight to the emergency room because we don't want the emergency rooms to be flooded with people who may or may not have this illness. If you do not have a primary care physician, you want to also go to health.baltimorecity.gov, and there's a list on the website of all of the Baltimore City clinics that will take people who do not have insurance or who are underinsured. And there we go. We got it right here.
We're gonna read the clinics off for y'all again. The addresses. So these are Baltimore Medical System clinics. 2323 East Orleans, 900 South Caton, 3120 Urban Avenue, 3700 Fleet, 1001 Pines Heights Avenue, 1245 Eastern Boulevard, 1111 North Charles, 631 Cherry Hill Road, 421 Fallsway Road, which is healthcare for the homeless, 3319 West Belvedere Avenue, 4151 Park Heights, 4120 Patterson Avenue, 2400 Kirk Avenue, 1515 West North Avenue, 2401 Liberty Heights Avenue, and 1111 Washington Boulevard. Those are the places that you can go.
And we're asking that you, when you pull that list up, that you call ahead. Let's see. There's one on here about where people aren't showing symptoms. Well, I think this is the key piece of all of this, is that what we know about this particular virus is that it can take up to 10 days in some instances for people to start showing symptoms. And so I think this person's raising a great point that, we do want as many tests as possible. Obviously, you see in the news, other countries are getting these tests out by the thousands per day. I think we do not have that capacity at this moment from the feds, but are working to get there. But what we're asking for is if you stay home, isolate yourself, because you're right that you may not show symptoms for 10 days, but you could be contagious over that 10-day period. And that's what makes this thing very different than what we've seen from other illnesses, is that people can be asymptomatic for an extended period of time and still affecting people around them. That's why we're saying stay home if you can, telework if you can. Do not gather in large groups. If you have to eat out, which we want you to do, take it to go, because you may not show symptoms and you could be infecting people along your journey. So we want people to stay home.
So there's somebody said repeat the Easy Pass information. So they're going to tolls in Maryland. So if you go through the tunnel right now and you don't have an Easy Pass, they're going to bill you based on the picture taken of your tag. That's the information that we've been given. But if you have an Easy Pass, clearly will go through. And then people said, how are people not on social media going to get this info? That's why this is important. You that are here, that are listening to us, please share all this information. You can print this stuff out from our social media pages and take it there. I actually was doing that earlier before we did this live feed out in East Baltimore in a safe way with gloves, keeping my social distance, giving this information, putting this information on people that I know don't have access to the internet. Also, we know this information is going to be out on the news, right? The news media. There'll be PSAs. We have to get this information out in an organic way as well.
Yeah, we do know that I know for sure the mayor's office is working on PSAs. Stay tuned for that. We are trying to get this information out to as many channels as possible. We do know that there are a lot of people who don't have social media, who may not watch TV. That's where that word of mouth comes from, but as long as you're keeping your distance.
Right. Somebody had a question about going to God first. Listen, and I say this in all due seriousness and respect. We all want people to practice their faith and believe in their faith and in their convictions, but we also want people to follow the signs and be safe. We cannot have people being reckless. This is a public health pandemic worldwide. This is serious. More people are going to die. People in Maryland are going to die from this. We're going to make it through this, however, by making sure that we are following the best practices and the advice of the public health professionals, no matter when we're at home, at work, at school, in the church, in the mosque, or the synagogue. We all have our duty to our fellow man and woman to make sure that we're being safe.
All right, so we have food access still available to students. Is food access still available for students at the same sites next week? Yes.
Yes. And if you guys will read the sites off to you, you want to do the school sites?
So we have, and actually, I'm going to read the ones that we have right here on this list, but I think there's a couple more that have been added.
Oh, I got the other ones too.
So we have Sandtown Winchester Achievement Academy, Dorothy I. Height Elementary School, Alexander Hamilton Elementary School, Historic Cherry Hill Elementary Middle School, Yorkwood Elementary School, John Rohrer Elementary Middle, Arlington Elementary School, Beachfield Elementary Middle, Sinclair Lane Elementary Middle, Paul Lawrence Dunbar High. And while the council president's reading off the Rec and Park sites, I'm going to pull up because there was just an announcement on additional sites. Hold on one second.
These Rec and Park sites, right? These are places where you can get dinner from 2 to 7 p.m. Bentlow Rec, Curl F. Cook, C.C. Jackson, Cecil Kirk, Chick Webb, Coldstream, Collington Square, Crispus Attucks, Curtis Bay, DeWeese, Edgewood Lyndhurst, Ella Bailey, Ferrenbury Brook, Fred B. Lottie, Gardenville, Greenmount, Harlem Park, Heron Run, James D. Gross, James McHenry, Joseph Lee, Lakeland, Lillian Jones, Locust Point, Madison Square, Mary E. Rodman, Metfield, Morrill Park, Mount Royal, Northwood, Oliver, Parkview, Patapsco, Cherry Hill, Rita Church, Robert C. Marshall, Samuel B. Morse, Solo Gibbs, Virginia Baker, Patterson Park, and Woodhome.
Okay, and earlier today, there were additional school sites that were added, and these are open from 10 a.m. to 2. Forgot to mention that in the beginning. City Neighbors Hamilton, Mary G. Faring Elementary Middle, Hollibird Elementary Middle, Lakeland Elementary Middle, Pimlico Elementary Middle, Gwynns Falls Elementary, Franklin Square Elementary Middle. And all of those are available on both the health department's website, city schools website. The other thing I'd mention though is some inside info is that there is a emergency food work group that is currently actively right now trying to get more sites online. So we know that there are gaps that exist in locations, and we want to make it as easy as possible. So I know that work group is contacting all of the partners that usually participate in the summer meal sites and the summer meal programs to try and get more sites online that are in some of the gap areas that we know exist. So stay tuned for more of those because those are going to be coming online throughout the week. And as far as we know, this is going to be for the foreseeable future. This is not a 1 week kind of deal. Let's see what else.
So you got any more questions coming in?
Closed it. My bad, y'all. Here we go. Emergency food stamps. Play outside. Non-essential stores and hotels.
So closing non-essential stores and hotels. So right now, of course, we want our grocery stores, our pharmacies, the banks and stuff to be open. They have not. No one has talked about closing other places as long as they're following the public health guidelines of having people not gather in 50 or more. Right now, that is not the conversation. But again, at all costs, we want people doing what we know will help stop the spread of this disease. And so do not go just because you can't go to the restaurant or the bar. Let's not everybody go to GameStop and be in GameStop 40, 50 at a time. Everybody shouldn't be going into DTLR or Foot Locker, everybody at the same time. Let's be responsible and just know that this is something that we have to get through by following the best advice that we have from public health professionals.
So there's a question. My neighbors are allowing their kids to play outside. What advice would you give? That's a tough one. We're asking that even for young people, that families are giving them the exact same advice, making sure that they're washing their hands, that they're keeping their distance, even if they're playing outside. I don't think a bike ride is a bad idea, but if they're wrestling and that kind of thing, we just want to make sure that they're keeping their distance, right? We don't want a situation where kids are not being kids. but we do want to make sure that they are protecting themselves as well.
Yeah, and it's hard even for adults. For example, the councilman and I will not be playing in our weekly basketball games for the foreseeable future, right? It's very hard. But we want people to be responsible at all costs. So for us, adults who are going to be home, right? That's a way for us to relive our childhood a little bit, and also teach kids about games that we used to play, right? Like Foursquare and stuff like that, where you can have your social distancing and still be able to be active. But also, I have to say this, we also want to remind people that this is not a vacation for our young people. They have school work to do, and we have to make sure that they're doing that and that they're keeping up on their work as well.
So there was a question here about, heard that seniors are most impacted. Are there food sites catering to seniors?
Oh yeah, we have those.
Yep.
Yep, we have those. Give me 1 second. We got the number that you can actually call.
Yeah, is it Maryland Access Point, right?
Yeah, I think that probably had the number. We just had it too. Second. Oh, sorry, you guys. We got the councilman and I have a lot of information in front of us. We're just trying to get to the right one about the seniors.
Oh, here we
you
go.
got it?
I had it up here.
Yeah, me too.
We'll come back to it.
Yeah, we'll come back to it. We'll find it.
The answer, yes.
The answer is yes. We
Maryland Access Point is the number, or they can call 211.
Yeah.
We do know that there are, again, that same work group I mentioned is doing outreach to vulnerable seniors, vulnerable groups. They are also working on meal delivery service, but that is still coming online right now, and we'll get that number for you. Let's see what else we got. Has the April 7th deadline for voter registration been pushed back? I have not heard that. And anything related to the election is coming from the governor's office, and so we're also asking that that you follow the governor's page as well. They're regularly posting every time there's a new mandate coming down from the state. That information is posted on his page, his social media sites. So we are monitoring that as well, but at this point, that date is still what we have to go by.
So this is something I think that we actually missed too, Councilman. Also, for question we got consistently over the last couple of days, no, we will not be ticketing for moving across the street and all those kind of violations. Those things will not be happening from the city's standpoint either. What else do we have in there?
Kids on playgrounds.
Same. I think that's the same thing as we just said before, right? I think that we have to make sure that our kids are being safe too, because yes, they're not as high risk as seniors and other people with pre-existing conditions, but we know that they also too can contract this virus. But we have to make sure that we are being responsible, right? And we have to help them understand as adults and say, listen, we want you to play, but going out and touching playground equipment that's been touched by lots and lots of people is something that might not be in the best interest. So we as adults have to figure out ways to keep our kids engaged, but that are also able to keep them safe.
All right. So for seniors, call 410-396-CARE. Again, 410-396-CARE. So that's 396-2273 for to determine your eligibility for the home delivered meal program. Let's see what else we got. If someone who is asymptomatic recovers from COVID, are they now immune? So if you are recovering, at this point, we're not sure the answer to that question. I have been following a lot of the data and research on this. I think it's too soon to tell. I do believe I read that there was an incident in China that the person caught it twice. So I think it's safe to say that we don't know just yet. Social distancing is the answer to that. Let's see.
And just a reminder for everyone listening too, if if you go to BaltimoreCityCouncil.com, we have a right on top of the page, we have a COVID-19 tab that you can click to get all this information that we're talking about.
Yep, all the way on the far right hand side. Did you go through the MTA changes?
Yeah, I did that. Yeah.
Okay, all right, just want to make sure.
But we should do that. Actually, I don't know if I did. Go ahead.
Okay.
Yeah, we did.
So the governor also announced some changes to bus service today. All of this is available on mta.maryland.gov. Click on coronavirus updates. But this just actually right hot off of the press, hasn't even been up for an hour. One, if you're riding an MTA bus, they're now asking that you enter from the rear, and that is so that we reduce the amount of contact with the drivers. We want to keep our drivers and our workers safe. We're also asking that if you can, pay for your fare on the Charm Pass mobile ticketing app and just display that instead of having cash or that kind of thing being exchanged. For right now, it doesn't seem that there are changes to routes, but if there are, we'll post it. The light rail is operating on its Saturday schedule, and that's during the week. So Monday through Friday, they'll be on the Saturday schedule. So if you go online, look up the Saturday schedule. The same applies for the subway. But there's another piece. If you are taking the subway to Johns Hopkins, that entrance is closed until further notice. The MARC train is on the R schedule and all 3 lines effective today. And there are a bunch of details on each of those lines available on the website. As far as mobility, we've got this question a few times for our seniors. This service is continuing to book and provide medical trips to dialysis, chemotherapy, hospitals, clinics, mental health facilities, as well as trips to pharmacies and grocery stores. Any other trips, they're not going to take. Again, all of this is online, mta.maryland.gov. It'll also be on all of our social media pages, probably by the end of the day today.
Right. I guess the next thing will be check to see if we have any questions. The state of emergency. Yes, the state of emergency is in for the state of Maryland. So it implies for the entire state of Maryland, including Baltimore City. So everyone heed that advice, right? So if you know someone that runs a restaurant or bar, or someone who wants to still have their meetings of 50 people or more, they are violating the law and can be held accountable for that.
And there was a question about food stamps. That's way above us. That is the federal government. We will continue to work with our federal partners to get that information out. In fact, just today, I was on the phone call with Senator Van Hollen's office because I got a question about postal delivery. Can I get the coronavirus from my mailman? One, if postal delivery people are symptomatic, they will be tested. However, they're not doing any other, they're following the same protocols as everyone else. But they also have a lot of science and data that shows that they do not believe the virus can be transferred easily on things like paper and cardboard, which is 99% of what's being delivered to your house. I would also note that I read on the news earlier that Amazon is not doing any deliveries for anything other than essentials. And so if you have essentials, they will deliver. If they do not, they don't even go on the website. But we will continue that communication with our federal partners, but that program is a federal program, and so we're following their lead and their guidance on that.
So there's a couple questions here, right? Will Baltimore survive this economic impact? I can't be more clear than this. This is going to be rough and tough, but we're going to make it through the other side. Again, we've already asked and start to put pressure on our state and federal folks to understand that we are going to have to come up with some sort of economic package and incentives, and even some folks are using the term bailout for the folks that are that are going to be most directly impacted by this. We hear that on the federal level. Even President Trump was talking about it today. You have folks, senators talking about universal basic income for all Americans. What we're going to do here at the local level is make sure that our local businesses, our local employees, the people that are working in Baltimore who are going to be most impacted by this, and the people that are impacted by this benefit from working together, which has to happen between local, state, and federal. When you're talking about a global crisis like this, that's a global health crisis that will also cause a global economic crisis at the same time. And we can rest assured that we're going to push and make sure that we are doing right by people in Baltimore.
President, can you readdress the question, your response about the homeless shelters, the shelter in place, that kind of thing?
Yeah. So this is something that we've gotten a bunch of times too. So the homeless shelters. So our homeless shelters are now doing what they call shelter in place. What that means is that people are not being put back out on the street. No, we are not mandating that all homeless people be tested. They will be tested in the same way as the councilman just laid out for people based off symptoms. Bulk trash and trash is on regular schedule as of right now. That has not changed. When you hear that, you'll hear that from DPW, from the mayor, and from us here at the city council.
Yeah. And if there are changes to city services, we'll let you know.
Yeah, we will let you know.
How can people donate for homeless youth? Great question. So the recommendation I'd give right now would be to email my office or the council president's office. We do know that the administration is compiling a list because there's been an outpouring of support of people wanting to help, which is amazing. Thank you all for doing that. Just trying to figure out what is the best way to both get all of those resources in and distribute them safely, right? Because it's a tough spot because we want people to help. We want people to give, we want people to support each other, but we also don't want you to be in large groups. So send us, if there are people who are looking to help, you can email me at Kristerfer.Burnett@baltimorecity.gov. And if you go to baltimorecity.council.com, you can get my name spelled correctly, because I know I'm gonna have to repeat that like 50 times. But you can, or you can email KRISTERFER.BURNETT@baltimorecity.gov, or a lot easier, council president at
baltimorecity.gov.
Yeah.
Or you can reach us by phone, 410-396-4804 in my case.
Or 410-396-4818. And we will add you to the list if you are trying to help out, because we do want that.
Curfew. So this is a question that's come up. As of right now, there is no curfew. We have not heard any talks of a curfew. We've seen that in places around the country and around the world. This is why the measures that were put in place to try to slow the virus down, so the spread of virus isn't so drastic that we have to go through those measures. But what we have to do again is we are always going to make decisions and be adhering to the suggestions of the public health professionals. They are the ones who have to guide us in everything that we do through this crisis.
Okay.
Any other questions?
I think we got it.
No. All right. No, some more. We got more, Chris.
Yeah, trash pickup. So yeah, all city services are on schedule.
Yep.
Trash pickup is still the same. Street sweeping still the same. If you don't move your car, you're not getting a ticket. Bulk trash. We're going to try and I've had several conversations with the administration about this. They're going to try as hard as they can while both trying to protect our workers and support our communities. But we want to keep city services, core city services, operating as often as possible, as long as we can. So your trash will be picked up. And matter of fact, we may come and pick it up if we need to, man. We're going to do whatever we got to do.
The next one.
The group limit, 50 or 10. This has been a little bit of a confusion, right? So the advice that we've been given from the state is 50. But we've heard the president yesterday say 10. The president of the United States said 10.
Not me.
Yeah, not him. the other guy said 10. We would say avoid groups of any size if you can. Now, obviously, if you have a lot of family members in your house, that's a little bit different circumstance. You have 10 kids, you can't get rid of the 10 kids. You got to keep all 10 kids. But otherwise, if you can avoid large groups of any size, of any amount, small or large, just do that, because that guidance is going to change. But yeah, that's the answer, because we know that there's been some confusing information on that.
So it's a question about, is the community service office still open? Can you expand upon that? Because what we have done now here in the city is that walk-up counters, places where you walk up and do business with the city, they are not. You have to do that stuff by phone. But if you could expand upon what you mean by that question, and we would get that out.
I think we had that question from Anthony Price.
Anthony, if you send us you can send us a message on Facebook, and we can follow up directly further with you on that.
Yeah.
Any other questions? If not, we just want to say a few things, right? For me, again, I say this every day. The most important thing that we can do, in addition to adhering to the advice of the public health professionals and listening to all the information that we've been sharing with you and utilizing that, is spreading that information and looking out for one another, for your family members, right? If you're like me and you have grandparents here and parents who are older, check on them. Don't allow them to go to the grocery store and get their own groceries. Do that for them. Get their prescription for them and take it and leave it on the porch. And don't you dare go inside and go put it away from them. Let them do that themselves so that you are not putting them more at risk. But also your neighbors, young people in your neighborhood, people that you know have to work and can't be there watching their kids. Look out for each other. Together is how Baltimore is going to make it through this. This is what we do when there's a crisis every time in Baltimore, and I know that we'll be the best Baltimore we can be through this.
Yeah, I think you said it best, man. I was at my aunt's house earlier, dropping off some supplies, left them on the porch, didn't give her a hug or kiss, but said I love you. And that's what we're at right now. And just, again, those phone calls, checking on people, that's invaluable. And I know it's happening. People are reaching out to my office. People want to help. Thank you all for this opportunity to speak to you today. Make sure you lock in on all of our pages so that we can continue to provide that information to you. I'm on Facebook as Councilman Kristerfer Burnett. I'm on Instagram as Kristerfer B. And on Twitter as Councilman KB.
I am on Facebook as facebook.com/councilpresbms, PRESBMS. That's also the Instagram and Twitter at councilpres, PRESBMS. So you can find me there. Those are my handles on all social media. So thank y'all for joining us in a council president and health chair live across social media. The video will be up and more information will be coming from us.
Yep, and again, remember, BaltimoreCityCouncil.com for updates, health.baltimorecity.gov for updates. Peace.